Good morning. It's close getting to the afternoon here at 1524 Vista Drive, Decatur, Georgia. Yours truly, Dolphy Gilpin. I'm here as promised with possible solutions to the COVID-19, the virus that has caused a pandemic around the world. And previously, we did an epidemiology study with the chronology of pandemics up to the time when we had about 7 to 8 pandemics there that we included, with some of them being stronger. Spanish flu and the bubonic plague were the strongest, or the Black Death. Then we went on secondarily to just introduce the structure of certain chemicals that was possible to bring about solutions. We introduced the structure of the COVID virus, or the CoV-2, a novel virus, meaning new. The virus is an RNA virus, and we did all of that sort of biochemistry, microbiology. Now this morning we're doing some possible solution. Let's get into it. Okay, we say now that I've extrapolated with my AMZ 5cos12 matrix, and this extrapolation bring about 60 drugs that is possible right now to bring about solutions to this COVID virus. Some of the drugs attack the virus, and some try to conform the human body to be adapted to fight the virus. So there are two perspectives. Some of the drugs attack the virus, and some conform the body to fight the virus. So of the 60, there could be possibly be more or less, but I'm talking about that brings about a remarkable, significant response, positive response to fighting this virus. And as this virus is a novel virus, we might very well need novel drugs. Novel meaning the new drugs, not drugs taken from the already synthesized arsenal of drugs that we have in our world today. It might take a newly synthesized drug to bring about this optimal result. However, in the meantime, as a scientist and medical scientists and medical doctors, physicians, and all those healthcare professionals who are working on to bring about this novel drugs that would fight and annihilate the COVID virus response, attacking or offensive response to humanity. In the meantime, we'll have to use drugs that is already with us to do the battle. Now, azithromycin has been touted in high medical circles and high political circles to be one of the drugs that is in the forefront of the battle. And let's see how, by looking at the structure and the properties of azithromycin, how it really does help in fighting this virus. Also, azithromycin in combination with hydroxychloroquine or chloroquine, possibly bringing about even a better response. Now, azithromycin is similar in structure to erythromycin, and it's derived from erythromycin. So it's a similar in structure, and it's yet the source of erythromycin. It was derived from erythromycin. Azithromycin is an azolide class of macrolide antibiotics with bactericidal and bacteriostatic activities. It is used to treat certain bacterial infection, bacteria causing middle ear infection, tonsillitis, throat infection, laryngitis, bronchitis, and pneumonia. Well, let's highlight the bronchitis and the pneumonia, because these are two of the prevalent abnormality that is on account of the COVID virus attacking the body. We have pneumonia type symptoms, and we have fibrosis or scarring of the lungs and tissue, so that it attacks the lungs the most. Pneumonia and sinusitis. It also treats STDs, sexually transmitted disease or sexually transmitted infectious disease, such as non-gonococcal urethritis and cervicitis. Like other macrolide antibiotics, azithromycin inhibits bacterial protein synthesis by binding to the 50S ribosome subunit. And this 50S subunit, the S standing for Sevberg, SVED-BRG, which is the man I think that bring about this subunit. And it's some sedimentation rate and molecular sort of sedimentation rate, speed of our settling time, molecules. So let's turn over here and binding to the 50S ribosomal subunits. And you have 50S, 70S, 30S, and 40S. We'll not get into that more deeply as well. And we're trying to other bacterial 70S ribosome. All right. Now this binding inhibits the translocation step of protein synthesis and consequently inhibiting RNA-dependent protein synthesis, leading to cell growth inhibition and cell death. So notice that the virus is RNA virus, and what this azithromycin does is it attaches itself to the 50S subunit and to the 70S ribosomal subunit, and this binding inhibits the translocation step of protein synthesis and consequently inhibiting RNA-dependent protein synthesis, leading to cell growth and inhibition cell death. Azithromycin differs from erythromycin in that methyl substituted nitrogen atom, which gives the azolide thing, is incorporated into the lactone ring, and thus making the lactone ring 15 membered. And we have 14, 15, and 16 membered lactone ring in this case. And the brand name is Zmax or Zitromax and or Sumamed, and is that azithromycin is one of the world's best-selling antibiotics, and it's been looked at by the World Health Organization and the NIH as to be the drug at this time that will possibly give us a good fight, put up a good fight with the CoV-19 or the CoV-2 virus. All right, let's continue here now with our response. Now, as in all cases, I have drawn the structure of these generic drugs. And here we have azithromycin, and here we have erythromycin, and we could compare the two structures to see that the structures are similar, and that azithromycin was derived from erythromycin. No other drugs that are similar and have similar properties as azithromycin would be clarithromycin and telithromycin and clindamycin. All those drugs have similar properties, but they differ in structure and in properties. And that is good sometimes because even in the time of penicillin, then and now, we had, though penicillin did such a wonder to our world in fighting off that medical abnormality that attacked the world at the time, penicillin. Some people are not compatible with penicillin and show allergic reaction, and therefore have to get a different drug. Similarly, with this azithromycin, they might be isolated patient that the drug doesn't do good to, or they have allergic reaction, severe allergic reaction, and in other words, they are not compatible, and other drugs have to be found that would do the job. In the case of penicillin, then what we had when a person is allergic to penicillin, some people try some doctors, healthcare professionals try erythromycin, and there are other tetracyclines that can be substituted. This might not bring about the congruent response as penicillin, but will bring about good response in fighting the infection or the disease at large. So here we have the azithromycin derived from erythromycin, and we look at the chemical structure. And I've always drawn the chemical and the molecular structures of these pharmacochemical structures of these generic drugs or the brand name, so that we might, from this perspective, see all the structure by altering the structure, or we could choose another drug at time by just looking at the structure, or even synthesize another drug by looking at the structure of these generic drugs and chemicals. So we have now C30H72N2O12 for azithromycin molecular formula. And down here I have sort of shown in a ring shape. Let me try to pull this here. And if you notice, this circle has about 14, 15, 16 sides with a nitrogen incorporated in the ring here. Nitrogen incorporated. And it's the same one as this, though this is smaller. And I've sort of drawn the oxygen attack, these zeros, oxygen represented, and the hydrogen in different colors. Try to give it a psychological goal. In the original diagram, in the smaller diagram, we have the O atoms in red, and red is usually psychological, meaning stop in our world today, or danger. So I drew the ring, 14-member, 15-member ring, given this in a green color, green meaning health, and green meaning go, just for a psychological sort of spin towards this thing. So this is a azithromycin with its lactone ring and with the nitrogen incorporated into the atoms there. And here we have, not to scale, the benzene type with the 6-member thing structure attaching to it, and the oxygen. So this is the same. But this is drawn in the color green, and it is enlarged. All right, let's get now over to the chloroquine, or the hydroxychloroquine, which is said to be in combination with the azithromycin that is giving this positive response now in attacking the COVID virus. And we said, you know, that chloroquine, or hydroxychloroquine, we said, you know, that viruses need cellular receptors to gain entrance into the cells. And hence we have to deform the configuration of the cellular receptors. So these viruses need the cellular receptors to gain entrance. And sometimes when, like in this case, when the COVID virus attacked the body and try to gain entrance via mostly the lungs, it has an easy pathway because of the configuration of the virus, the RNA virus, and the configuration of the cell. The corona sort of those things, as we've shown, I try to show it in these locks, fit neatly into the cellular receptor, and therefore it's an easy entrance. So if we could configure the virus transmitters, or configure the cells of the body, their receptors, so that it's not easily invasion that can occur, then we would have done well. So we could either attack the virus or configure or change the configuration of our cells so as to prevent easy access by the virus. Now what this chloroquine does, or the hydroxychloroquine, let's go on further. So preventing the COVID-19, the RNA virus, from entering the major receptors, which are ACE receptors and the COX-2 receptors. Alternatively, if we could alter the configuration of the COVID-19 transmitters, the coronas, and make entrance into the cells hard, or difficult, then we would have done well. So we could either change the configuration of the virus, or change the configuration of the cellular receptors. And we say no, that chromostat mesylate shows, this is one of the chemical, the pharmacochemicals that shows a positive sort of reaction. It has a 1,000-fold reduction in viruses attacking itself to lung cells. That's chromostat mesylate. You could experiment with that to see exactly how this could help us in our fight against COVID virus. Also, this is the structure of the chloroquine, or the hydroxychloroquine, whose brand name is plaquenil, or if you know what PLAQUE is, like plague nil. You can remember it easily by sometimes drawing mnemonics or looking at the word plague, yes. So what we are going through now is like a plague with this COVID-19, and this is plague nil. That's just a little way to say it. Nil means zero. If we could zero the plague by using this plague nil. And the generic name is hydroxychloroquine, C18H26Cl N305S. So here we have the combination of azithromycin and hydrochloride, which shows to be right now at the forefront of the battle. Like I said, extrapolating with my AMZ 5x5 matrix in the pharmacochemicals configuration, there's a lot more drugs that can be in the fight, and sometimes we have to bring them in because of a patient who shows allergic reaction to azithromycin and hydrochloroquine. And they have to get other drugs that is compatible to their medical condition. So the extrapolation bring about 60 drugs at this time that can bring about remarkable or very positive response to this negative drug, if you would so call it, that causing this pandemic in the world today. And there might well be over hundreds, but I'm trying to bring about now in what you call quality response or optimal response. But others might bring about also good response to this in attacking this virus that attacks the body and cause the SARS, severe acute SAR respiratory syndrome. And the severe acute respiratory syndrome at first start off mild, then it moves on to mild, moderate to severe, and then it progresses to death if it's not countered by medical response. So we'll take a break here, and this was just a brief introduction to solutions via pharmacology and microbiology and biochemistry that would bring about optimal solution in attacking this COVID virus, or SARS-CoV-2, that is presently attacking humanity today. So we will return at another time with some other response to this COVID-19 or SARS-CoV-2.